To access free topic sheets, worksheets, or to book an online class, visit ilearneasy.co.uk. Dental diseases. There are many different types of dental diseases. It's important to understand dental diseases in order to be able to identify them in their early stages to prevent irreversible tooth damage. It's vital to maintain good oral hygiene practices, such as regular brushing, flossing, visiting your dentist for checkups, and consuming a healthy diet with minimal sugary snacks and drinks. In this video, we will learn about the common dental diseases, how to identify them, and the treatment options available. Enamel hyperplasia. This is a developmental defect that affects the outer layer of the tooth, which is known as the enamel. It means that the enamel is thinner than normal or incompletely formed. Enamel hyperplasia can result in teeth that appear pitted or grooved, rough or uneven, discolored, and they're more prone to decay or sensitivity. Enamel hyperplasia usually occurs when something interferes with the proper formation of enamel during childhood. This is when the teeth are developing. Some common causes are nutritional deficiencies, especially vitamin A, C, or D, high fever or illness during early childhood, prenatal issues, for example, maternal illness or premature birth, infection, for example, measles or chickenpox, trauma to a developing tooth, genetic disorders, or exposure to toxins. The treatment for enamel hyperplasia depends on its severity. Alongside regular dental monitoring to prevent decay, some treatment options are fluoride treatment to strengthen the enamel, bonding or resin fillings, or crowns in severe cases. Granuloma. A granuloma is a small area of chronic inflammation caused by the body's immune system. This is a result when the body's immune system is trying to wall off substances it sees as foreign, but it can't eliminate. This can occur anywhere in the body. In the mouth, it can often occur at the tip of a dead or infected tooth. There are different types of granulomas, such as infectious, non-infectious, and foreign body granuloma. The treatment for granuloma depends on the cause. Some treatment options are antibiotics, root canal treatment, tooth extraction, or surgical removal. Cyst. A dental cyst is a fluid-filled sac that forms in the jawbone or soft tissues of the mouth, often around a dead or developing tooth. It's lined by epithelial tissue and usually grows slowly. Some common causes are untreated tooth infections, impacted or unerupted teeth, trauma to the tooth, developing disturbances, or genetic conditions. The treatment options for dental cysts depend on the severity. Some treatment options include surgical removal of the cyst, tooth extraction if the associated tooth is non-restorable, root canal treatment if the tooth can be saved, marsupialization for large cysts. This is a procedure to reduce the size before full removal. Alongside this, regular follow-ups are required to check for recurrences. Caries, also known as tooth decay. Dental caries is the destruction of tooth structure caused by acids produced by bacteria in dental plaque. Over time, the acids break down enamel and can progress deeper into dentin and eventually the pulp if untreated. If untreated, This can lead to irreversible complications, including the loss of the tooth. There are 3 stages of caries. Superficial caries. This is also known as initial or enamel caries. This is limited to the outer enamel layer. It appears as white spots or a slight discoloration. This is not often visible unless dried or seen on X-rays. Superficial caries usually has no pain, but it may cause mild sensitivity to sweets or cold. The treatment options are remineralization and sometimes sealants or small preventative fillings. Medium caries, also known as dentin caries. This decay extends from the enamel into the dentin. The dentin is the softer layer beneath the enamel. The decay appears as visible brown or black spots or even holes on the tooth. This can be detected on clinical exam or X-rays. Medium caries causes mild to moderate discomfort as well as sensitivity to cold, sweet, or pressure. The treatment options include removing the decay and restoring the tooth using fillings. Deep caries. This decay reaches close or into the pulp. The pulp is where the nerve chamber of the tooth is. This decay appears as a large visible cavity, often with tooth structure loss. Deep caries causes severe pain, sensitivity, and can lead to infection or abscess if untreated. The treatment options depend if the pulp is infected. If the pulp is not yet infected, then the treatment options are indirect pulp capping or deep filling. If the pulp is infected, then the treatment options are root canal treatment or extraction. Pulpitis. Pulpitis is the inflammation of the dental pulp. This is the soft tissue inside the tooth that contains nerves and blood vessels. Reversible pulpitis refers to mid-inflammation of the pulp. The tooth can heal on its own if the cause is treated early. This can be caused by early cavities, tooth grinding, exposed dentin, or recent dental work. Reversible pulpitis can result in short, sharp pain triggered by hot, cold, or sweet. The treatment is to remove the cause of the inflammation. This includes cleaning the cavity and placing a filling. Irreversible pulpitis. Irreversible pulpitis refers to severe or lasting inflammation in which the pulp cannot recover and it starts to die. This can be caused by deep cavities reaching the pulp, cracked teeth, or untreated reversible pulpitis. Irreversible pulpitis can result in lingering or spontaneous pain, even after the hot or cold trigger is gone. This pain can progress to throbbing pain or no pain if the pulp dies. The treatment is root canal treatment to remove the infected pulp or tooth extraction if not restorable. Plaque. Plaque is soft, sticky film made up of bacteria, food particles, and saliva that constantly forms on your teeth. After eating, bacteria in your mouth feed on sugars. The bacteria produce acids as a byproduct. These acids attack your enamel, leading to caries, which is tooth decay, and gum disease if the plaque is not removed. The plaque often builds up along the gum line, between teeth, on molars, and around brackets, crowns, or fillings. Plaque untreated can lead to cavities, gingivitis, or it can harden into tartar. Plaque can easily be prevented and treated by ensuring you brush your teeth twice daily, floss between teeth, alongside going for regular checkups. Tartar. Tartar is hard dental plaque that has been left on the teeth for a long period of time. It forms when plaque isn't removed and calcifies, making it very difficult to remove with regular brushing. This often builds up along the gum line, on the inside surfaces of the lower front teeth, around fillings, crowns, or braces, and on molars. If untreated, tartar provides a rough surface where plaque and bacteria can continue to grow. It can lead to gum disease, cause tooth discoloration, and results in bad breath due to the bacteria trapped in tartar. Tartar can easily be prevented and treated by ensuring you brush your teeth twice daily, floss between teeth, alongside going for regular checkups. If tartar has formed on your teeth, then professional cleaning is the only way to remove it. Gingivitis. Gingivitis is the inflammation of the gums, often caused by bacterial infections from plaque buildup. It's the mildest and earliest stage of gum disease, and it's usually reversible with proper oral care. Gingivitis is caused by plaque buildup on the teeth due to poor oral hygiene. It can lead to red, swollen, and tender gums. It can cause bleeding, bad breath, and for the gums to recede slightly. If left untreated, gingivitis can progress to periodontitis, which is more serious and harder to treat. Unlike periodontitis, gingivitis doesn't involve bone or tissue loss, so it's fully reversible if treated early. Treatment options include professional dental cleaning to remove plaque and tartar, consistent brushing and flossing at home, and antibacterial mouthwashes if required. Gingivitis can easily be prevented with good oral hygiene and regular dental checkups. Periodontitis. Periodontitis is a serious gum infection that damages the soft tissue and can destroy the bone that supports your teeth if left untreated. Periodontitis is a progression from gingivitis, the mildest form of gum disease. It's usually a result of poor oral hygiene, allowing plaque to build and harden into tartar. Periodontitis results in swollen, red, or bleeding gums, bad breath, receding gums, and even loose teeth or tooth loss. The treatment options for periodontitis are either non-surgical or surgical. Non-surgical treatments include scaling and root planing. Surgical treatments include flap surgery, bone grafts, or tissue regeneration in advanced cases. Periodontitis can be prevented with good oral hygiene, not smoking, and managing health conditions like diabetes.